been wearing my Colorado cap these days. Most of us, a lot of us are wearing surgical caps or something. But this is our resuscitation room. This is where ambulances will come in and bring sick kids right away, or if we have someone that starts getting really sick in the department or through our front doors, we'll bring them right in here. This can even function as an operating room, so we have, in CPR cases, we've even crashed kids to ECMO multiple times since I've started my fellowship here. We see a ton of patients, and this is where they come for their specialty care, so we see it all. No 2 days are the same, that's for sure. The emergency medicine program here is so strong, and the faculty are so amazing. I decided to continue my training here, and then when I decided to switch to focus on pediatrics instead, again, the program here is so strong that I decided to stay because I knew what training I was going to get. I could see it firsthand. I had rotated through the peds hospital here as an emergency medicine resident, so I had no question or doubt about what the program would be like, so I stayed. And then the same thing when I was looking at pediatric emergency medicine fellowships, the question was, okay, do I go somewhere else? I've done all my training here. You're supposed to vary your training, they say, and go other places. But the attendings here are amazing. I just felt like there's such a good chemistry and dynamic, and they support the fellows so well, and they treat the fellows with such respect, and we see such sick patients here. We see such high volume and such a variety of cases that I couldn't leave. From my medical education, when I did med school here, all the way through, my training has been fantastic. And like I said, I feel like from the training I got here, I could go anywhere in the country. You know, I could take a job anywhere, coast to coast, and be ready for that, and be ready for anything that rolls in the door. I'm Kelly Bailey. I'm one of the fellows. I'm finishing my second year of fellowship, and I'm about to be a third year fellow here at the Children's Wisconsin Emergency Department. I'm one of the MCW fellows, which is the Medical College of Wisconsin affiliated hospitals.
Here on the wall, I'll get them back there.
Hello.
Hey.
Is that okay?
On your count.
1, 2, 3.
It's one of my favorite parts of the job. I was, a high school athlete, still love sports, so it's that same mentality that we are a team. We have our different roles, we function differently, we have our different skill sets, but without each other, we can't get the job done. We need each other to get the job done, take care of sick kids, take care of the patients that are coming in. There's a lot of respect here in the emergency department for each other and our roles, and when there is a trauma that comes in or a child that needs resuscitation in the resuscitation room, we operate like a really smooth team because everybody knows what to do. We work well together, we rely on each other, and that's one of my favorite parts of emergency medicine is the teamwork. And I think even just the way that we're set up down here, we're physically close to each other. We're not separated by an entire hall. So it's so easy to collaborate with each other. Nurses can grab us, we can grab nurses, we can talk, we can chat. How's your day? How are your kids doing? Hey, how was that sports game? Hey, can I ask you a question about this kid? Did you see this? It's just really easy. We get to know each other really well, and then that fosters that sense of teamwork, like you're doing this together, and that's why we like showing up and doing what we do, and we can take the best care of kids that way, honestly. Hello, I'm Dr. Bailey. How are you?
I'm good, how are you?
Good, I'm one of the ER docs. What happened?
So we were playing in the swimming pool yesterday. We have a blow-up swimming pool, and he was trying to get out by himself, and he slipped.
Okay.
And he hit the side of the swimming pool.
Okay.
So, I think I was just telling her, my grandma was a nurse for 40 years, and so I called her first.
Yeah.
I call her first for everything. And so,
Just the go-to.
yeah, so she said, because it wasn't bleeding, but I don't know, maybe because it was the water. But she said as long as he wasn't like crying too hard and he was still eating, like she was eating a banana and stuff, she's like, maybe because of the COVID, don't take him in. But
Yeah.
he woke up and his lip didn't look like that yesterday. It swelled significantly overnight. So I just wanted to make sure he didn't need to get sewed or like...
Yeah. Well, why don't we do this? I gotta get a good look, and He's probably not going to like it. What I would recommend is I can pop up the bed a little bit, have you sit with him in your lap so that he feels safer. Yeah. And then help hold him and we'll get a good look. The good news is if it's just on the wet mucosa, it doesn't need repair and they heal really well on their own without antibiotics.
You're okay.
Yeah, that's just a scab on the outside. I don't have any worries that that's actually a through and through lesion.
Okay.
Just staying away from the OJ and the...
Okay. Hot Cheetos and stuff.
Yeah. But otherwise looks great.
All right, awesome. Thank you so much.
You're welcome.
I saw him from the doorway.
Oh yeah, lips swollen. He's got a little scab on the outside, but it's not through and through. I actually think he just scraped the outside. There's nothing open that needs repair. Perfect. I just want to make sure Okay, perfect. Thank you. It's great because our catchment area is so big. Sometimes it's hard in a really large city because there's a lot of hospitals where patients get distributed between, whereas for us, we are the only tertiary care pediatric center in this area. So our catchment area is all of southeastern Wisconsin, all the way up to the UP, down into northern Illinois, and that's what makes it really unique. Simple lip laceration. Didn't need repair, which is nice. Ordering some ibuprofen, because I know if I was a parent, I'd never be able to keep track. You know, it's hard to keep track when you have multiple kids or even just one of what their dose is, because kids grow so quickly. So I like to order ibuprofen and Tylenol as needed for my patients so that they have that and they have the dose. They're good to go. So the nurse will take in the discharge paperwork and they'll be on their way. And then we just wait for the next patient.